Walnut makes me happy and it makes me look forward to coming to school in the morning and seeing him and giving him pats.
Oh, that's awesome. He loves getting pats.
He's a good boy. Such a good boy. Hey. And I've been told that I'm the only one that he sits still for.
Yeah, because you've got treats that you bring in for him.
Yeah, but then whenever I sit down on the ground, he always stays next to me.
That's good.
Unless, of course, someone new comes in. Alright. Come on, buddy. Okay, can you do this one? Spin. Yes, good boy.
So Zali, why do you like having Walnut at school?
He's like really, it helps like balance the mood of the school. And he makes us all feel like really happy and like relaxed, I guess, if we're ever stressed at school, yeah.
Hi, I'm Kate. I'm one of the vets at Companion Animal Vets, and this is Walnut, our patient today. So Walnut's owner let us know how stressed Walnut gets at the vet clinic. So we sent her home with a couple of tablets to take the night before and then again the morning of the procedure, just to really calm him down and make the whole transition into the vet clinic a lot easier for him. It brings down his general level of anxiety and just makes it easier to do the sedation, as well as making the whole thing just less stressful for him. So that's why he's been wagging his tail and happy in the clinic, at least in the reception area, which is great. So he's come in for a dental scale and polish, which is a cleaning of his teeth. And we're also going to be clipping his nails today because he gets quite stressed when we clip his nails when he's awake. So lots of dogs can be, having their nails clipped without any sedation. They're pretty fine with it, but he's really quite stressed when we touch his feet. So we're going to do it while he's nice and sleepy and calm, and so it's not quite as stressful for him. So today, because he gets so stressed at the vets, we're going to be practicing fear-free medicine on him. We'll be doing his sedation out here in the waiting room where he's nice and relaxed, and then once he's sleepy and calm, we'll take him through and start the dental straight away, just so we can get him done quickly and so it's as least stressful as possible for him. This is Callum, he's my nurse. He's going to be helping hold Walnut for the injection. He's quite needle phobic, so we're going to try and make it as quick as possible to reduce the stress, and then after that we're just going to let him chill out and relax and let the sedation take effect, and after that takes about 10-15 minutes. We'll just take him through into the rest of the clinic. So Walnut is quite stressed with needles, so what we're going to do is try and let him warm up to us a little bit. Once we get him a little bit more relaxed, we'll get a hold of him and quickly give him an injection. This is the sedation. It's something that goes into the muscles, so we have quite quick effect. We're currently just sort of trying to get him to a position that will be conducive to Callum holding him for this injection. Oh, Bubby. All right, done. All right, so as you can see, the injection part is a bit stressful for him, but once it's done, it's done. It's very quick, and now we've just got to let it take effect. So we're just going to let him chill out, calm down. As you can see, he's already wagging his tail again and sniffing the ground. So I think we'll just give him a few minutes and then we'll come back and see how it's affected him. Sometimes dogs need a little bit of a top-up. Sometimes the sedation's not quite enough, so we start with the basic sedation, and then if they're really, really stressed, we might need to add a little bit more, and that's fine. We've just got to go to effect until they're nice and calm and ready to go into the rest of the clinic. So Walnut's almost ready. He's had his sedation and it's taken a little bit of effect, but I think he's just needing a little bit more to get him to the point where we can take him out the back without it being stressful for him. So we're going to give him a tiny little top-up and then give that a little bit of time to take effect, and then hopefully that'll be enough for him. Okay, sedation's now kicked in to the point where we can touch his arms and give him a little bit of extra sedation just before we send him out the back. So we've been unable to get a catheter in just because he's really afraid of the clippers and it's just waking him up every time. So we're just going to give him a tiny little bit extra IV so it goes really fast, so we don't have to wait the extra time, and so it's a bit more potent, and then we'll take him out the back and get everything done. So furry. So Walnut's now anaesthetised and we've intubated him, so he's got a nice direct flow of oxygen and anaesthetic gas into his lungs. We're just monitoring his anaesthetic now and we're about to get into his dental. Cal's gone around and clipped all his nails so they're nice and short. Usually that's something we can't do with Walnut because he is so stressed about it when he's awake, so this is a really great opportunity to do that. Usually we require a sedation, but we're just doing it today. It's really important to clip dogs' nails if they are getting a bit long because they can cause quite a bit of discomfort when they are getting overgrown, and they can even grow so far as to go into the dog's paw pads, and that's quite a painful condition and it can get infected. So it's good that we can get that done today and have it be as least stressful as possible for him. So Cal's just started the dental on Walnut now. What he's doing is running an ultrasonic scaler over the teeth to remove calculus and plaque. This reduces the inflammation around the teeth caused by bacterial buildup. This will continue to build up over time unless the owner brushes the teeth or gives lots of things to chew on so that they're getting rid of that build-up each day. So he might need dentals periodically if they're not able to brush his teeth at home or he's not really a big chewer. But this is a pretty quick procedure. It's really good for dental health and it prevents them getting to the stage where they need teeth removed. So every time you get build-up, eventually that leads to gingivitis, and that can start to really eat away at the bone around the teeth and start causing a lot of inflammation and nastiness around the gums. So this is a nice procedure that will be over quickly, and it'll hopefully prevent a lot of suffering and discomfort for him in the future. Alright, so Cal's finished the scaling of the teeth and now we're up to polishing. So that's just buffing out the teeth and reducing the likelihood of developing calculus in the future. And after this, it'll be the final step of his dental. So after this, we'll wake him up and let him recover in the kennel room. He'll wake up nice and quietly. And when he's fully recovered, we'll let him go home with his family, and that'll be it for today for him. So that's it for Walnut for today. He's had his scaling polished, he's had his nails trimmed, he's recovered really nicely and he's gone home with his family. So sometimes with the sedation we do need a couple of extra injections, and that's okay. We just adapt to each patient and we just try and manage the anxiety level to make it as fear-free as possible. So with Walnut, what we had to do was just get him almost completely asleep out in the waiting room and then just take him in because that's where he was the most comfortable, and that's okay. We just want to make it as easy as possible for them so it's less stressful next time they come round. If you have any questions about what you saw in the video today, please leave us a comment below. And if you think your pet might be stressed or anxious about coming to the vets, then feel free to give us a call and we can discuss a fear-free management plan with you.